Hey guys, welcome back to my channel. Today I'm going to do a quick video on how to find a primary healthcare provider. So that's either a family doctor or a nurse practitioner here in Ontario. And I believe this is pretty much applicable to other provinces as well. However, the information I'll be sharing will be more specific to Ontario. So stay tuned. So, hey guys, the easiest way to find a primary healthcare provider in Ontario is to use this government website. Now, the way to navigate to get to the website is to go on your Google search engine and just type in Healthcare Connect Ontario. Once you type that in, it takes you to a bunch of search results. I'm just kind of doing this right now. So I think usually the first or the second result should say ontario.ca, and there should be something about find a doctor or nurse practitioner. Click on that and it takes you to the website, and in big bold black letters, it's going to say find a doctor or nurse practitioner. I really like this website for so many reasons. Information is quite easy to read and it walks you through what you need to do. But first off, I'm just going to quickly talk about nurse practitioners. Now, I want to talk about this because lots of newcomers to Canada, even native born Canadians, many people still do not understand who a nurse practitioner is, what their scope of practice is, what they can do. And this website does not differentiate. It just says find a doctor or nurse practitioner. And the reason is that nurse practitioners, especially primary healthcare nurse practitioners, are nurses with advanced education, advanced skills, advanced knowledge, advanced training. And I'm a nurse practitioner myself, so I'll say we are able to perform similar services as family doctors. We're trained for this. So if you get paired with a nurse practitioner, please do not think for one moment that you're getting lesser care. Not at all. If anything, you get to spend more time with us. Yeah, we get more time with patients compared to family doctors, and most patients appreciate that. But I'm not saying I just think they're two different professions that can meet the needs of the population. That's the way I see it. So don't feel like you're getting lesser care because you have a nurse practitioner. Nurse practitioners can do pretty much similar things as family doctors in primary care. Now, going back to this website, if you scroll through the website, it gives you the option to register with something called Healthcare Connect service. And when you register with this service, what happens is that you get paired with a family doctor or nurse practitioner who is around your area. Based on your postal code and the information you provide, you get paired with somebody. Now, obviously, I don't know how long the process takes, but it just really depends on so many factors. If there's a new clinic in town where you live, proximity to the clinic, how many spots are available. It's just what conditions you have. So it just depends on a bunch of things. So I don't know. It can probably take anywhere from weeks to months. That's all I'm going to say. There's really no time frame here, but it works. I was able to find my own family doctor many years ago through this service, so it works, and this is what I recommend. So when you go on there and you scroll down, there's a big blue button that says register for Healthcare Connect online. I encourage you to go ahead and register. Now, who can use this program? If you have a valid OHIP card, if you do not have a primary care provider, so if you do not have a doctor or a nurse practitioner, then this program is available to you. I'm going to stress that because there are people who don't like their current doctors or nurse practitioners. Sorry, you still wouldn't qualify for this. Or maybe you moved houses and you wanted somebody closer to you, then you wouldn't qualify for this. These are for people, for Ontarians. I don't know what the right word is. I'm sorry. I'm just going to say people in Ontario who have a valid OHIP card and who do not have a primary health care provider. The other way to find a nurse practitioner or doctor around you is word of mouth. So if you if you have doctors or nurses or healthcare providers around you, your community, um, ask them. You just never know, because many times it's word of mouth, and if new clinics open up in town, most times they reach out to colleagues already in the area, and you just never know. So just ask questions, reach out, talk about it. You just never know. The other option I would want to recommend, now this is 50-50. It's to reach out, find a community health center in your area. However, most community health centers cater to vulnerable population, and every community health center differs because their vision, their purpose, their agenda differs. Some community health centers take every patient, and some only take certain population. Some might only take maybe women, people with certain health conditions, newcomers, vulnerable population, while some other community health centers run like regular clinics where they accept everyone as long as there's a spot available. You go through the application process and you're accepted and you're assigned to a provider. So community healthcare centers, they all differ. So a community health center, the way it's run here in London, Ontario, probably will not be the same as a community health center in Toronto, right? So every community health center differs in terms of structure, clinic, the population they see, and things like that. Resources available. There might be a dietitian in the one in London. You might have a physiotherapist in the one in Toronto. So it differs. But community health centers can be very amazing, in all honesty, because many times there's the resources. They have extra healthcare providers such as maybe counselors, social workers, dietitians, physiotherapists in some. And again, and you have access, or psychologist services, you have access to all these extra additional services if you are a patient of that community health center. So reach out to the community health centers in your various communities and just ask if they are accepting patients, and you might be lucky. You might be accepted. You never know. But it's another avenue to definitely try out. So that's all I have for you guys. I wish you luck as you look for a doctor or nurse practitioner. If you have specific questions for me, you can send me a DM on Instagram, or you could just leave comments in the comment section, and I will do my best to read through and respond to any questions you have. Other than that, that's all. Thank you so much. If this video has been helpful, please give a thumbs up. Until next time. Bye.